So this is a very short collection of slides on ophthalmic drugs. I'm really going to focus on the treatment for glaucoma and then just go over some nursing considerations. And I'll just briefly touch on like antimicrobial drugs. These slides and the information is from your Lilly Pharmacology book, chapter 57. So I would star this slide. You do definitely want to know the difference between a mydriatic, a myotic, and a cycloplegic. So mydriatics dilate the pupil by contraction of the iris dilator muscle. The myotics cause pupil constriction, and cycloplegics paralyze the ciliary body, but they also have dilating properties. So an example might be a dilated eye exam that you may see a cycloplegic used. The most common examples are in the parentheses, but I would focus on knowing the definition of a mydriatic, myotic, and cycloplegic. So there's quite a few different ocular drugs, some of which you may have administered in clinical. These slides are really going to focus on anti-glaucoma drugs. I'll just touch on the antimicrobial, so antibacterial, antiviral, antifungal, but the rest of these I'm really not covering in these slides. We did talk about anti-inflammatory drugs pre-procedure for some of our visual disorders, and then there's some other anti-allergic drugs, moisturizing eye drops, diagnostic medications that we're not really covering in detail. So I'll let you read through these different ocular drugs. These are all used to decrease intraocular pressure, and that's really what we're focused on with glaucoma, is increased IOP. So I'll highlight these classes for treatment of glaucoma on the next few slides. So the cholinergic drugs, they do cause pupillary constriction or miosis, and it really helps facilitate drainage of the aqueous humor, therefore decreasing intraocular pressure. It can be used for both open and closed angle glaucoma. The most common example would be pilocarpine. Because these do mimic the parasympathetic nervous system, most common side effects, hypotension, and I'll let you read through the rest here, but headache, those are two of the most common side effects. So the sympathomimetics, exactly kind of how the name sounds, they mimic the sympathetic nervous system, so those neurotransmitters, epinephrine and norepinephrine. They do enhance the aqueous humor outflow through the canal of Schlemm, therefore decreasing intraocular pressure. This class of medications that causes pupillary dilation is common for the treatment of open glaucoma and ocular hypertension. The most common example is listed here on the slide, brimonidine. The most common side effects would be just local side effects, burning, discomfort. There's some more detailed rare side effects. So the beta-adrenergic blockers are one of the most common classes prescribed for the treatment of glaucoma. They do decrease intraocular pressure by reducing aqueous humor formation and increasing the outflow. They have no effect on the pupil size. It's for the treatment of open angle glaucoma and ocular hypertension. You can recognize these easily by the OL. I know you've been administering systemic beta blockers in clinical, so this is the same class but in an ocular preparation. So some common side effects for the beta blockers might be burning, discomfort, some light sensitivity or photophobia, blurred vision. We do want to apply pressure on the inner canthus of the eye to limit systemic effects, but there certainly is a risk of systemic effects, which could include dizziness, bronchospasm, bradycardia. So you really want to include a past medical history with your assessment. That's super important, and identify conditions like asthma, cardiac conditions, diabetes. We talked about the effects of beta blockers on hypoglycemia awareness. So you would definitely want to include that glaucoma assessment with other medical conditions. So the carbonic anhydrase inhibitors, these should sound familiar. They are one of the diuretics that we discussed. And I know I really didn't go into detail mentioning that I would cover the carbonic anhydrase inhibitors in more detail when we covered glaucoma. So this class of antibiotics inhibits the enzyme carbonic anhydrase, which reduces aqueous humor formation in the eye. So it actually does result in decreased intraocular pressure. So the carbonic anhydrase inhibitors can be used for both open and closed glaucoma. There's oral and ocular forms of this medication. With the oral, you do have increased risk for systemic effects, which are listed here on this slide, but another class of drugs to treat glaucoma. Osmotic diuretics, we did go over with the diuretic section. This class of drugs is really used in the emergent acute angle closure glaucoma. It has a very rapid onset. It can be administered IV, orally, or topically, and it really rapidly decreases the intraocular fluid, therefore reducing intraocular pressure. The osmotic diuretics, most common side effects, nausea, vomiting, headache. You do want to monitor for fluid and electrolyte imbalance. So this is the newest class of glaucoma treatment, ocular drugs, prostaglandin agonists. These increase the outflow of aqueous humor. They're once a day, daily dosing, which is attractive for clients, and it decreases the intraocular pressure for 20 to 24 hours. So it really doesn't have an effect on the amount of aqueous humor, but it does promote the outflow. It can affect eye color, which is permanent. And it's common for the treatment of open angle glaucoma. For other ocular drugs, antibacterial, antiviral, antifungal, most common side effects would be local burning, stinging, but drugs that you may see that are pretty common. So just a few aspects of administering ocular drugs that I wanted to just kind of review. You do want to have your patient kind of tilt their head back or lean back, look up at the ceiling. When you're placing the ophthalmic medication in, you want to place it in the conjunctival sac and apply pressure to the inner canthus for at least 1 minute to reduce systemic absorption. And that can really help with some of those systemic side effects that we talked about with some of the classes of drugs. You do want to pay particular attention to the amount of drops ordered, monitor for those side effects that we highlighted, and if your client is on more than one eye drop, you do want to make sure you're administering in the correct order and having at least 5 minutes in between each drug. And of course, good hand washing, and we would be teaching our patients the same.